The Health Minister, Kwaku Agyeman Manu, set the tone for the media engagement with a frantic appeal to Ghanaians to abide by the preventive protocols such as the wearing of face masks.
Over the weekend, I drove around town, some places, and people are not wearing the masks. Meanwhile, some of us are selling the masks by the roadside. And it is not very, very, very expensive. But I know, even if it's 1 cedi, some of us will not have money to buy. So those of us who have a little extra, more than 1 cedi, when you buy one with your 2 cedi, buy one for your next neighbor. That has been the Ghanaian way of life. We support each other. And I'm pleading with companies, organizations, churches, those who have. There are those of us who don't have. We need some to wear so that the president will know we are listening to his advice. So the idea of I don't have money to buy should not be an excuse from anybody. We see people in the middle of the street begging for money. So that money you are begging for, use some to buy the mask.
The Director General of the Ghana Health Service, Dr. Patrick Adhere, reiterated the case count and indicated that over 200 persons were awaiting a second negative test to be fully declared as recovered.
Currently, we have about 294 of the patients who have recovered after testing negative on 2 consecutive times, and we currently have more than 200 patients awaiting their second negative test so that they can also be declared recovered on discharge. One of the key areas of intervention is isolation, where people who are positive, who have are asymptomatic and do not have any underlying conditions are either managed at home or sent to an isolation center. Currently, for our isolation center, we have 453 patients across the country in various isolation centers.
Director of Public Health, Dr. Bedusa Akodi, in response to a question, said the country had reached the peak of its COVID-19 infection curve.
If you look at how Ghana started attacking the virus, waiting not to chase the virus, but then face it directly by doing enhanced contact tracing, there are a lot of people that we tested that were not having symptoms. So if we are using the daily case incident with the signs and symptoms, then that will have a challenge. So clearly, the best data that we are using for this bell-shaped curve is the use of data from the date samples were tested. So where we are now, we started having a build. The first confirmed case in the country was on the 12th of March. So we realized that with a sharp rise, and now with the cases that we are testing, clearly we seem as a country to be on top of the peak, and we are at a stage to decline. That is the observation now. The declination will depend on how we adhere to the various preventive etiquettes that have been enumerated.
Head of Biology at the Noguchi Memorial Institute of Medical Research, Professor William Ampofu, said the backlog of test samples at the institute had been cleared.
The backlog. So I just cross-checked with Professor Richard Phillips of KCCR, and he has 1,982 samples awaiting testing. It was 3,500 yesterday, so they worked all night. And he expects that by Thursday, the backlog will be done. For Noguchi, we have no backlog. There are 0 samples awaiting testing. So, as the Minister said, we should be able to provide results within 24 hours back to the Ghana Health Service when samples are received from contact tracing and also from hospital surveillance.
So even though the number of cases of COVID-19 keeps rising by the day in the country, the managers of the health system say that based on the compliance with the various protocols, prevention protocols, washing of hands, sanitizing of hands, among others, so long as these protocols are complied with, very soon there will be a downward spiral of the number of cases in the country. Reporting for Citi News from the Information Ministry, my name is Duke Mensopoko.